Live from the Channel 11 studios, it's Great Day Houston.
Welcome back, everybody. There's been a lot in the news recently about the lethal nature of some prescription drugs, which begs the question, how safe are they? Here to fill us in is Dr. Stephen Hotze from the Hotze Health and Wellness Center. Welcome. You're not exactly a big fan of prescription drugs, but you do realize when they might be necessary.
Yes, in some cases, they can. Like in case of a severe infection, antibiotics can be very helpful. Of course, they can cause problems. You've got to treat the problems they create. They can cause yeast problems, as we've talked about in previous programs. But overall, remember, drugs are chemical molecules that have been created by drug companies that never existed before in nature. And the body has to detoxify them, and they have to be detoxified by the liver. And what is a toxin? Do you know what another word for a toxin is?
Poison?
Poison, right. So literally, drugs are poison, and all of them have a lethal dose 50, LD50, where if you gave it to a certain set of the population, enough of the drug, 50% of the people would die. So drugs in and of themselves can kill you, and they do. As a matter of fact, there was a study done in the Journal of American Medical Association published in 2000 that said on an average, every year, over 100,000 people die in the hospital due to the interactions of drugs that were FDA approved and doctor prescribed. That's 100,000.
Yeah.
Mind you, you know how many people died of the swine flu? Maybe 100.
Okay, let's back up with something.
We're talking 100,000 people die every year from drug interactions in the hospital. How many more are debilitated at home because of side effects of drugs?
Right. You said FDA approved, and I think oftentimes what people hear when they hear FDA is they think, oh, 100% safe.
Well, like let's talk about Vioxx. Remember the anti-inflammatory prescription medication? Maybe some of the audience took it one time, Vioxx, but Vioxx killed over 234,000 people from heart attacks, and it was pulled from the market. That was FDA approved. We have the statin drugs that are very popular, the Lipitor and the Crestor and all these, but they have a host of side effects. One, they always tell you on the TV programs, be sure to get your liver checked. Why? Because it can cause liver cancer and cirrhosis of the liver and liver disease. It also can cause severe amnesia in people, and because it sucks the cholesterol out of the brain, so you can't think clearly. So in older folks, oftentimes they'll get on these statin drugs, and the next thing you know, they can't think clearly, and they say, Mom and Dad's got Alzheimer's disease, when they really have a side effect from the drug. So drugs can be Tylenol, for instance. You know, several thousand people die each year from Tylenol, taking too much Tylenol, because it also has to be detoxified by the liver, and it causes severe liver problems.
The key word you said there, taking too much.
Right.
Is that the biggest problem, is taking too much, or is it just the nature of what you're taking?
Think out over time. They haven't done any prospective, they haven't done long-term studies, 5 and 10 years down the road. They didn't know Vioxx was going to kill all these people when they made the drug originally, but all of a sudden, over a 5-year period, all these people started dying of the drug use. So my point is, we need to be very cautious when using drugs, and we need, rather than to try to mask the problem with the drug, if you got inflammation in your joint, just don't take an anti-inflammatory, which, by the way, those anti-inflammatories lead to death from stomach ulcers. It burns holes in people's stomach. My mother had the problem. She had back pain, and she was popping these, and next thing you know, she had a bleeding ulcer in her stomach. We had to take her to the hospital. I said, what are you doing? Well, I'm taking these for my back pain. Well, there's thousands of people, really tens of thousands of people that have severe gastrointestinal problems due to all these anti-inflammatory drugs, which can lead to death.
Do you think one of the big problems for us is that we're self-medicating and self-diagnosing?
Well, I think the big problem is that we're not addressing the underlying cause of the problem. And what's the underlying cause of people's problem? As people age, okay, we've had doctors on our show talk about weight can lead to joint problems, right? Well, what if we can get our weight down? Well, how do we get our weight down? We correct our hormonal imbalances. We get on thyroid if we need it. We correct the female hormones or the male hormones to help us get our energy level up, so we can get our metabolism up, so we can get our weight down when we eat properly.
And of course, bringing weight down can also avoid things like type 2 diabetes.
Type 2 diabetes and high blood. And remember, the type 2 diabetes drugs that they give now increase the risk of heart problems. So you can treat diabetes either with a pill and leads to more side effects, or else you can get your weight down and exercise, get your hormones in balance, and correct the underlying cause of the problem rather than just taking a pill to try to mask the problem or correct your blood sugar.
And what you're saying there is that we need to take more responsibility for our own health, because that's something a doctor can't make us do. Oftentimes by the time we show up in the doctor's office, they're going, yep, you got a problem, and we've bypassed what we were supposed to do on our own. We need to go back to that.
Everybody needs to take charge of their health, their own personal health, and address the underlying cause of the problem, and don't look to drugs for a fix.
Yeah, don't treat the symptoms, take care of the problem.
Right.
All right, Dr. Hotze, thank you very much. You can listen to Dr. Hotze's radio show, Health and Wellness Solutions, Monday through Friday on 700 AM KSEV from noon to 1 o'clock p.m. And for more information, call the Hotze Health and Wellness Center at 281-698-8698, 281-698-8698, or you can log on to hotzehwc.com. We'll be right back.